Hey guys, it's Jerrick here from MMT. We've got Ninja here on the table. Today we're going to treat the hip flexor complex. So some guys might think hip flexor is just one muscle, but it's actually a group of muscles that make up the complex, okay? So let's get started. We'll start off with the psoas, okay? So I'll locate the psoas. I want to work with Ninja's breath. So Ninja takes a couple deep breaths in and out, and I just sink my way through in here, nice and slow. So the psoas is directly connected to your lumbar spine on the front edges of the spinous processes. So it can have an effect of how much curvature your back has when it is tight, okay? And I'm just gonna check if I'm on it with Ninja. Just gonna like slide your heel towards your body, yet, and it pops up underneath my fingers, and then slide it back down. And I might just need to readjust just a touch, take a deep breath in and out. You might ask why psoases can get tight. It can be due to sitting down for too long, or it could be even weak in that sense as well. So it's good to get some flow in these regions and free up the back. Gives you a bit more of a better platform to use your core and use your hips.
So you've got to negotiate the organs, haven't you?
Yeah.
Yeah, large intestine, especially down this sort of low.
Yeah.
So you've got to get it around behind that if you can. Yeah, it can stimulate a bit of digestion too, this sort of work.
Correct, yeah.
So yeah, it's good if you're blocked, constipated, and help you with your shit.
Yeah, literally, yeah.
Yeah.
People can feel, like their stomachs can be moving, or like things are moving in and around this this gut area. Some people might get referrals down the leg or in the back if they are experiencing back discomfort or back pain. And all these areas we're going to go no wax. No wax. So it's going to allow me to go much slower, a lot more holds. Allows me to stay patient.
Most of all more effective, eh?
Yeah, more effective, absolutely. Yeah. Not rushing. Good. And Ninja's just playing with his leg, just experimenting movements. And I can feel it underneath my hand, just moving just very slightly. So even someone that comes in with, like, let's say an acute back spasm, and they come like a day, 2 days after to see me, I would normally come to here first. Relax the defensive mechanisms. This calms the nervous system before going into their back spot or the money spot.
Take some tension off the back.
Yeah.
It's just joined onto the back.
Correct, yeah.
Spine.
And do you feel any referral here, Ninj?
Nah, it's just local. Yeah. It's an interesting sensation. That's why I mentioned digestion, because you can feel like it is involved.
Yeah.
But yeah, you're really trying to target underneath that.
Yeah.
So.
And even muscles in that lumbar region share the same nerve connection and blood supply as organs in that vicinity as well. So yeah, like you said, the digestion, urinary system as well.
Yeah.
And I can already feel it easing off under my fingers.
So much more comfortable now than it started off at.
Usually the initial part, it's like, can be sharp, feels very uncomfortable, but as soon as you allow time to do its thing, it softens up. And I might play just slightly with little angles. I might go this way. I might go towards, just slightly go up very slowly. Then I might pin it towards me a bit. And if I want to come out, I just go nice and slow. Good. Sink out how I sunk in. Just like that. Give them a couple breaths just to reset. So now we're going to hit the iliacus. So this is also a continuation, or can be seen as a continuation of that psoas, and it feeds into the inner part of your hip. So you got your glutes that are sit outside the hip, and these iliacus sits inside the cup of that area. So some people can do lots of glute work or do lots of exercises in that area. They can't really feel their glute working. It may be your iliacus that's inhibiting that range of motion or inhibiting that function. So we're going to check it now, okay? So this lives just inside of this hip here, okay? It's very pinpoint. It's tucked away, and it can be very tender. So we're gonna work with Ninja's breath again. And I find this is probably the most tightest one, or the one that compensates the most when people get those back spasms or have chronic back pain. How's this one going, Ninja, okay?
Yeah, good. Yeah, therapeutic. You get a sense of connection with my lower back.
Yeah.
I'm sort of trying to rotate my hip around just to...
Yeah, it's good. Opens up. Yeah, it opens up a
yeah.
little bit. Yeah, it's good.
So I can kind of, when I go like that, toes in, it kind of helps, increases the intensity. Then to go out, it kind of gives me a little bit of a break.
Yeah,
When
yeah.
you go into it again, you can kind of manage your own treatment a bit.
Yeah, yeah, okay. I can see that how we can, as you come out, it opens up, and then as you rotate in, it closes. So that'll be a bit more sensation. Yeah, same with me. I can kind of go down, or I can angle over the top and go more into the cup of the hip or the ilium. And we can work this at different range. We can go straight leg, we can go bent leg. I can take the leg up into 9 degrees and move it around. You can really be dynamic with this type of treatment. Yeah, these areas, you don't want to do too much moving of your thumb or too much moving even on yourself. You just want to, play with it. You're allowing the pressure to do the work. Yeah, and sometimes this can go all the way up underneath here as well, because the hip actually goes as high as that waistband. I'm just going to reinforce my thumb. I feel like there's a little bit more in deeper here. Good, and again, as I come out, sink out of that pressure. Okay. I want to show you maybe some dynamic stuff as well, what I do for the iliacus. So I usually have this bent. I can go here. I hook my elbow, I take the slack off, and I just, again, sink in. Now I have control of this leg. I can just move it, shimmy it a little bit. Especially people that sit down a lot, they're in this type of position. So I have that ability to move and lengthen this area. I can come outways. I can go circular motions. So it's probably not as full on with the pressure, but I'm getting that deeper release as well with the movement. I can come right up high. And then straighten out that leg. Sink out. So the last hip flexor I want to work on is that TFL. So these are going to be our 3 main ones we've hit today, yeah. So Ninja's just going to turn to you guys. This one sits just where I was before, but now it's on the opposite side. It's on the outside part instead of the inner part, okay? And I'm just here, I sink in. Very, very common. I can tell this is tight already.
Be good.
Yeah. Trying our best not to roll off. Need to get a good purchase, yeah. Yeah, some guys can feel like pain or discomfort can travel from this hip or the back into the leg, and it's most of the time this TFL.
Oh, you
Yeah.
got me now, man.
Yeah. Yeah, here it is. It's a sore one. Such a small muscle, but it's it can be thick. It can also compensate for a lot of your other movements as well. Yeah, especially your glute med, and it just has a lot of leverage just due to the connection into the ITB. It transforms into the ITB.
Strong little muscle, isn't it?
Yeah, yeah. Yeah, big tendon. You feel this one down the leg or?
Nah,
No.
just local. It's backing off now,
Yeah, good, good.
luckily.
Yeah.
I talk about this sometimes. Like I remember 25 years ago getting someone doing this to me, and it was like, "Fucking hell, this is
10 out of 10. Yeah.
overwhelming." It's
Yeah,
like
yeah.
pain like I had never felt in my life. Like
Yeah,
just
yeah.
that trauma, you know. Like I still remember it. You know,
Yeah.
when someone does this to me, it takes me back to that.
The body,
That's right.
body remembers.
Yeah, it does, man. Like, fuck.
So like all the other muscles, not too much movements, a lot more holds. Might change your angle a little bit.
That's good.
But this has the ability to make the leg feel lighter. So if your leg feels heavy, feels like it's sometimes hard to pick up, or lift your knee up sometimes, it's this can be definitely contributing to it. Again, if I want to coming out nice and slow, I can work different angles as well. I've kind of worked just the middle part. I can work on the front part or even the back side. Different angles. I think with this type of stuff, it's all about the angles. Yeah, so if you like what you saw, come check us out. Follow along. Thanks, guys.
Thank you. Done.